Afide. This is Governor Lou Leon Guerrero. If you're struggling to pay rent and utilities because of the pandemic, your government can help. Our Emergency Rental Assistance Program provides direct relief to you. To date, over $6.9 million has helped over 1,500 households.
Apply online at eoa.guam.gov or call the Department of Administration's Emergency Rental Assistance Program at 671-638-4518 or 19.
We are agents of change, shining the light on corruption, land scams, children being raped, growing violence, and the wrecking ball of poverty. While we have grown and been able to expose many of the dark corners of our islands because of the confidence you and our advertisers have placed in us, there still is so much more to do, so much more to clean. Kandit's flame must grow brighter. Fuel this fire. If you want the light shined on corruption in our governments, rape and violence against children and women, land scams and poverty, then advertise with us or sponsor our programming in Guam and the CNMI. Call us at 671-922-NEWS or email us at advertise@candidnews.com. This is the future. Fuel this fire.
Have you or a loved one been injured through medical negligence or substandard medical care? Are you angry? File complaints through the Guam Board of Medical Examiners to make physicians accountable. It's time that we stand up to protect our families and the people of Guam. The complaint form can be found at GBME's website, www.guammedical.org. Have questions or want the form emailed to you? Contact us at asher@asherdeanlubofsky.com or our Facebook page, www.facebook.com/bunzoasher. We do not provide legal or other professional info or services. We do this to improve medical care on Guam through medical accountability equity. Justice for those injured or killed through medical negligence on Guam.
And welcome once again to the Health and Welfare Committee.
Buenas Micronesia, I'm Troy Torres. Thank you so much for joining us again. It is the afternoon of February 15, and it is past 1 p.m., and the House Committee on Health and Welfare is underway with an oversight hearing about contracts in the CNMI using federal pandemic funds. Representative Tina Sablan is the chairwoman of the committee. She called this oversight hearing where members of the Torres administration hopefully will be answering questions about some questionable and shady contracts. Are we able to go to the coverage now? Let's go over to the coverage now.
And although not on the agenda, if members have no objections, we did go ahead and invite a representative from the public school system since questions did arise with respect to COVID-19 protocols as they affect PSS. And here today representing PSS is Ms. Lila Yumo, who is the Family Engagement Manager. And without further ado, if we could please invite our guests to come into the chamber, and you can take your seats at the center in front of me. Yeah. Representative McGoffney, if you could move up one seat or two more, because we will have quite a few guests here. Thank you. And as everyone's getting settled, I'd like to recognize Representative Sheila Babata, who is here today, and Representative Karina Magofnia, who is the Vice Chair of Ways and Means, and will also be asking questions in today's proceeding. Thank you. And when you're ready, we can begin. I'd like to start. I understand, Dr. Muna, you have another pressing engagement shortly after this proceeding. So, okay, all right. Well, why don't we start with you, and then we can move down the line to. Okay. You all have the same. Okay. Good to know. Mr. Guerrero, if you could please join the panel. Welcome, Mr. Joe Guerrero from the Homeland Security and Emergency Management Office. So let's start with CEO Munia.
Let's turn this on. So thank you for the invitation and the opportunity to share with you our COVID updates. In last, was it Friday? Yeah, that we had a presentation at Kensington in regards to COVID updates as well. We brought Dr. Lily Muldoon with us. Unfortunately, she can't be here today, but I did bring my team in case there's any specific questions that you wanted to ask from that. But
I'm sorry, Ms. Munia, could you just speak into the mic a little more?
sorry. I'm so sorry.
That's okay.
Okay.
And the doctor that you mentioned, who is
Dr.
that?
Lily Muldoon, she's our medical director for public health.
Okay, thank you.
Yes.
Please proceed.
So in that presentation, we talked about, our role, the health center basically, and the Commonwealth Healthcare Corporation in detecting prevention and mitigation strategies, right? So we talked about prior to the surge, during the surge, and even still now to the phase 2, especially with Omicron being prevalent in the community. So we have been making changes along the way. We've been shifting our strategies, looking at what's happening also in the U.S. mainland as well as in Guam, and really making the decision that provides the best, I guess if you want to say the best results, outcomes of all the patients or the individuals that have contracted COVID-19. So we have continued to work with the team here, actually all of them, working with them to try to make sure that the ACS, for example, is functioning as a subacute facility, able to serve patients that are, even if our census exceeds, from the hospital side. And, working with also the team to make sure that, and especially with our team, to shift some of the strategies that we're doing, such as contact tracing. In the beginning, contact tracing would have been the best thing to try to get to the index case. But as cases continue to rise, you have to start shifting on, what exactly is our goal. And our goal is to really try to get the treatment to the patients, trying to get them to reduce, to ensure that we don't hospitalize them. And so getting the MAP treatment, the monoclonal antibody treatments to them is one of our biggest priorities. So we've basically kind of stopped contact tracing in a way. Instead of, pushing the information to the patient, we're trying to basically pull individuals to come in and say, hey, I have this information. I want to be able to get the services to them. So rather than basically waiting for someone to call them and tell them what to do, that we're trying to push messaging out there and say, hey, this is what you should do. And really, I think it's been really working really, really well. Our numbers are, had gone down, but then of course, as expected, because of the large number of cases, we are seeing also an increase in hospitalizations right now too as well. But we've done, I think with the team, we've done trying to get, rolling out the vaccinations. We understood that Omicron is basically the booster shots are a good fight for the Omicron variant. So we wanted to make sure the boosters are out there, doing some outreach, village outreaches, trying to work with employers, and also even trying to get to, like, for example, the Sablu market is an area. So we continue to do what we can, and working with the team, with Gar and Warren as well, to basically do what we can to keep the population healthy, and safe, and yes, and avoid hospitalizations and death. So that's it. Thank you.
Thank you. And let's proceed to Mr. Warren Villagomez, Chairman of the COVID-19 Task Force.
Thank you, Chair Sablan, and everyone, members in this chamber. Thank you, CEO Munia, Gar, S.A. Gerald and Commissioner Wally and our Leila PSS rep for this afternoon's meeting. Uh, as we all know, the pandemic has really made the last 2 years unprecedented challenge. The single event alone has impacted our life, our economy, jobs, people, and business. This is truly one of the most significant moments in our history because the unprecedented challenges require unprecedented responses. Uh, at the height of the pandemic, FEMA initially projected CNMI to have significant number of COVID cases, deaths by June 2020. Mitigation was put in place and carried forward to date. And just a brief synopsis of where the task force is at, as well as the daily priority and support, alongside with CEO Munya and the medical staff and nurses at our Sentinel sites, as well as our um, Kanoa alternate care site, our new community COVID center site in Kobler, as well as working along with DFAMS to provide uh, on-site antigen test on Department of Fire and Emergency stations. Uh, with the Omicron surge continues to run rampant on our island, but this was unexpected. To come this at this height, but because of all the mitigation efforts, but its attitude is very aggressive, and we're continuing all efforts that we can to contain and strain that line, and we're doing everything we can, and we can see the evidence that we see every day that we've straightened that line with all the hard work of our first responders, our nurses, our folks that are coordinating the testing sites on a daily basis. So at the current moment, the alternate care site that we're doing is adding a high flow medical air oxygen um, system. It's on wheels. And why did we decide to make it to have it on wheels? So in the event that we need to shift sites, shift uh, care site to provide the services that we can relocate and strategize our efforts. So that is the biggest thing that we're working on, other than all the daily operation and supplies, as well as protective measures that we're implementing day to day. Thank you.
Thank you, Chairman Villagomez. And can we proceed next to Mr. Guerrero from our GAR for FEMA? Thank you.
Hi, good afternoon, Chairwoman Sablan and members of this committee, Health and Welfare. Um, to if we all sat here and gave our brief background, I think it's going to sound redundant because we do work as a team. So I'll jump maybe straight into my role as the GAR and give you updates there. But I'd be happy to answer any other questions later related to our whole of government approach if you have specific questions. As the guard to FEMA, of course, my main responsibility is to, um, get our expenses covered for our operations, our response to this pandemic. And brief update summary to give you is that, we continue till this day working with Homeland Security to ensure we have all the necessary tools to continue to fight COVID, whether it's PPE or contracts for quarantines and any other service that is required. After 2 years, we actually, depleted our supplies of what we got in the very beginning of PPEs, and then we started to replenish. Luckily, too, after 2 years, the national stockpiles have finally caught up to the demand all over the United States. And this week alone, we're receiving 12 containers of supplies from FEMA, direct from FEMA. Something if we had requested a year or two ago at the very beginning, would have been very difficult. So a combination of continuing to purchase what we need and receiving from FEMA additional support, I think we're set for this current surge that we're having, and if it changes behavior again, as we've seen it even in the last 3 months, I think we'll be prepared on that front. I keep the relationship going with the federal government, mainly FEMA, to continue to do that. In terms of funding and reimbursement support, to date, the CNMI government has received over $40 million from the Public Assistance Program alone, and another $35 million of eligible costs we expect will be reviewed and hopefully reimbursed sooner rather than later, to encompass the first 2 years of our operation. Millions of dollars in additional direct federal assistance has been provided and continues to be provided to this day, whether it's through FEMA contractors or direct support to public health. They do have a team of providers and nurses here currently working at both the alternate care site and MCATS, the medical care and treatment site up at the hospital. And we continue to extend those assistance with FEMA, with HHS's involvement as well. If you add the numbers, 40 million already awarded and $35 million additional expected to be reimbursed. But overall, our cost of our operations to date is right around the $94 million mark. And it goes, again, like I said, to the alternate care site, quarantine, emergency operations support, testing and supplies, disinfection services, in support of vaccination efforts, and other activities. Aside from public assistance support from the federal government, we do have 3 other programs that we've been able to avail of. Currently, we have the Crisis Counseling Program, which is under CHCC, under the Community Guidance Center. Over $1 million has been awarded for that program to provide crisis counseling services. That's a partnership between SAMHSA, I guess, at CEO, right? SAMHSA and the Commonwealth Health Center. The Lost Wages Assistance Program, that was a short-lived program, but we are just in the final phases of closing that out in terms of a grant closeout program, and we were able to utilize roughly $5.5 million from that program. The last program, federal program that extends to the CNMI is the Funeral Assistance Program. That's still an ongoing active program. Thankfully, we haven't seen that many deaths in the last couple of months. In the very beginning, we did, and hopefully that stays the same. But anyone who wants to avail of that program, unfortunately, there's no on-island support. It's a direct assistance program where an individual would have to contact FEMA directly. But we continue to provide support whenever needed to answer questions and things like that. And glad to answer any other questions you may have during this session. Thank you.
Thank you, Mr. Guerrero. And let's move to Essay Guerrero, and then we can hear from the 2 specific agencies that we had questions for.
Good afternoon, Chair, and thank you for the invite and members. I've prepared a brief statement on the response of this operation. CNMI Homeland Security has been assisting and supporting the Commonwealth Health Center, the COVID-19 task force since the beginning of COVID in March 2021. HSCM has afforded CAC with personal protective equipment for personnel stations at the airport since the end of 2019. There have been countless hours in which HSCM personnel have dedicated to COVID-19 response effort. To date, CNMI Emergency Operations Center has received over 4,800 requests since the beginning of COVID-19. Requests have ranged from personal protective equipment and supplies technology, and other services necessary to successfully combat COVID-19. The CNMI EOC have done its very best to accommodate the COVID-19 requests of CACC, the AOC, the alternate care sites, the quarantine sites, the multipurpose center, the airport, and the Coblerville COVID Center. These sites have been utilized in some way or another to support a piece of COVID response. The CNMI EOC continues to support the external partners such as DFEMS in ensuring that their logistical needs are met through this operation. The operations sections at the EOC continues to receive requests daily pertaining to COVID operations. The logistics sections continues to push out request items as soon as the order is complete or the items are requested or confirmed to be available. If requested items are not available, the procurement process will commence. The finance section and admin section has been working diligently on ensuring that timely payments are made to vendors. Our planning section continues to monitor the situation as it continues to evolve. CNMI HSCM, the CNMI EOC continues to stand ready to support the fight against COVID-19 and are willing to assist in any other way possible. Thank you.
Thank you, Mr. Dylan Guerrero. And let's hear from Commissioner Villagomez now.
Good afternoon, Chair. Good afternoon, members of this body. With about a third of the total employees and at least 30 inmates contracting the virus, it was necessary for their department and the task force and Homeland Security to immediately designate a quarantine site for inmates while employees affected were properly quarantined either at home or designated quarantine sites. The DOC facility is confined area and its ventilation system is not inadequately operating. Constant disinfecting for both the main facility and the quarantine sites was necessary to protect the health of everyone and to prevent the spread. Although COVID testings were conducted on site and strict preventative measures in place, it was inevitable to prevent the virus from entering the facility. Thank you.
Thank you, Commissioner. And let's hear from Ms. Yumo from PSS.
Good afternoon.
Ms. Yumo, if you could please speak into the mic. Maybe pull it up a little closer. Thank you.
Can you hear me? Yes. Good afternoon. Thank you, Chairwoman Sablan, for the invite. I'm here representing PSS. I serve as the Family and Community Engagement Program Manager for PSS, and I'm here to work alongside our COVID task force to support our families with the fear of anxiety that they have. And we want to ensure that with the guidance and recommendations with our task force, that we are able to ensure our families that our schools are the safest place to be and how best to support quality education. And so I'm also here to just receive inquiries and information that we can gather and provide to our families and to the committee.
Ms. Yumo, are you able to answer questions regarding the vaccination and testing protocols at PSS?
I will do my best.
Okay, thank you. And at this time, we can open up the floor for questions. I had a couple of questions to start us off for CEO Munya. Could you speak to the impact of COVID-19, especially with the Omicron surge, on hospitalization rates relative to other jurisdictions in the states, and the impact of COVID-19 on hospital operations to date?
Sure. So as I wish I had this slide to share with you also, but we did see that for hospitalizations, as cases rise, obviously hospitalizations will rise as well, especially if they don't have the protection of vaccinations, boosters. And so for the CNMI or for CHEC, um, you know, one of the concerns that we always have is the non-COVID issues, and we do see a lot of that. And it's been a struggle for us because the hospital is not a big hospital. It's a 76-bed hospital. It we started when we started operating or having a COVID unit at the hospital. It was 4 beds, then it became 8 beds, it became 12 beds. It just keeps expanding it, and that means that we have to start reducing some of the beds that we're utilizing for non-COVID patients, right? So we thought about transferring and opening the TLC, to see how we can move patients in the psychiatric ward, of course, with consultation with the psychiatrist and ensuring that the transition is done in the right way, meeting compliance and making sure that the patients and families were informed. But
sorry, that's the Transitional Living Center?
Correct, the
Okay.
TLC. But we did not proceed. There's certain things that we need to ensure that again it meets compliance, and it does require a lot of movement. We worked with the GAR and of course the task force to make those changes in the facility. But again, at this point right now, we're not ready to do that. So the ACS, we have patients who need to be put in observation, and they're basically being monitored as well because they are COVID patients. And so we would transfer a patient, for example, may not need the acute care that the hospital provides, but still requires observation and treatment. So we transfer that patient over to the ACS. For a while, it was stable at 8, then it went down to 5, then it went down to 1. In the last couple of weeks, it was 0, 1 for ACS. But again, as expected, we see that there's hospitalizations increasing again. So I believe yesterday was 13, I believe today was 11. Yeah. So the impact of it all is that, and we've had this discussion with GAR and FEMA. At the end of the day, it's only our staff that are actually there. We've had to split our resources. Have Dr. Didella. I haven't seen him in ages. Sorry, it's been that kind of operation really. Staff that have to be sent to the ACS, and then we have the other staffs that are also at the hospital. We've managed to use our other programs, to help out, whether in logistics, communications, anywhere basically they can help to basically make sure that we provide the support for the medical staff. We're with the change in contact tracing, for example, we're trying to make it more, what you can say is more attentive to the patient needs, and say, rather than how we were shifting before when someone is positive, we basically, the immediate action was, put them in quarantine, in isolation in a government site. That was changed when we were, with the cases increasing. And, again, what is our main goal? Our main goal is to try to save them, right? And so we had to shift that as well. And so those are things that we continue to change and change again, and rightfully so too. I mean, this is something that we're not just changing because we feel like it has to change, because the nation, we're learning a lot from the the 50 states, because they've had Omicron, right? And they're also going, their cases are going down. So we know what works and what doesn't work. And so, in fact, the Association of State and Territorial Health Officials came out and said something about contact tracing is just not effective for Omicron. So those are things that again, so we shift their responsibility to be a part of the assessment team. You know, they're actually at the MCATs providing, getting information and seeing what they can do to help that individual, whether, because some people still do need to isolate. Some people want to isolate, especially if they're protecting their family members. So, so the impact for us really is, it's been tiring for everyone. I think that's, everyone is just exhausted. Uh, but we'll continue to do what we can, and when we have support from FEMA or basically from HHS, it's kind of very difficult. It's not really, in some ways, and don't take this the wrong way, Gar, but he knows it. It's that sometimes it doesn't really, they're here to support, but it's not really what we need. So there could be, we appreciate it, so it's trying to adjust to what they can provide. So they're only here to tend to patients to provide monoclonal antibodies. What happens if a patient comes in with a toothache or something else? It's almost like it's hands off. We're not here for that. And so it's trying to work around that. That's been the challenge. And but Gar and Brian Beck from FEMA has been very helpful, and trying to see how they can help us with that. So we have to, try to push our staff over to work on the non-COVID and let the COVID team work on the COVID patients. And so it's helpful, but sometimes it can be challenging. That's all.
Thank you. Do you have any numbers on how many of your staff have themselves been affected by COVID?
We have over 100,
Over
maybe
100.
almost 200. Yeah,
Almost 200?
I believe almost.
Okay.
It was, I would say it's a little bit over 100 and 120, 150
Since the beginning of the pandemic?
since the beginning of the
Out of your total staffing of how many?
about 900 to 1,000. Yeah.
Okay.
So,
And today, like on this day, how many staff do you have out because of COVID?
well, because of the, CDC came out with staffing on conventional crisis, and sometimes we have to implement the crisis staffing, which means that even if they're symptomatic, even if they're positive, they can still work. So in cases for, we had a department where a hospital department that were all affected. It's you just don't shut down that department because it's a necessary department. Otherwise, CMS will come around and say, "Why are you not providing this service?" So that's when crisis staffing takes effect. Yeah.
Thank you. And then my next question for either yourself, CEO, or anybody who can answer this, it was reported the other day that a subvariant of Omicron has been detected on Guam. What do we know about that subvariant, and has it been detected here as well?
So it does take a while for us to receive our sequencing data to show that whether or not we have that variant here. We are monitoring it. We're looking at it as well. It's basically more infectious, and it could be here because we are seeing a lot of transmission. Quick, highly transmissible. Definitely, possibly might be here as well. But we do have the treatment. There's even a new treatment that was approved yesterday. So the allocations for the CNMI is coming. We'll be ordering that, and all of them have been shown to be effective for this variant, and also emphasis on booster shots. There's already data that's showing that as the months go by, you do see the effectiveness waning down. So we need to be able to try to encourage individuals that if you're due for it, you really do need to take it, get the vaccinations.
Thank you. And speaking of the shots, there was a very startling headline in the news the other day about CNMI reaching over 100% vaccination. Could somebody explain how that's possible? Where did these numbers come from?
So they're coming in from we made the adjustment with the census numbers, and that is calculated by our epidemiologist. And of course, again, as our comms chief here, Guillermo Lifoifois mentioned in the news that it was, you have to be mindful too that we do have people that may not be residents, and we did record that as a number. So we've had, I know in the beginning, I think you and I talked about this as well, contractors that are coming here, they're asking to get the shot. So we gave them the shot, even though they're not necessarily residents of the CNMI.
I see. So do we have an idea then, if we take out those non-residents who came in, whether they were students who were visiting and then left or contractors, do we know what the actual vaccination rate is for bona fide residents of the CNMI?
We have not unpacked it to determine which one is a bona fide resident or not.
Is it possible to do that?
It's possible, but it'll take time.
Okay.
Yeah.
Thank you. I'd like to open the floor now to other members who have questions. Oh, and I'd like to also recognize the presence of Representative BJ Attow. Welcome. Colleagues, do you have other questions for our panelists? Representative Magofnia.
Thank you, Chairwoman, and thank you, panelists, for coming in to answer some of our questions. To CEO Munia, you had mentioned about the subvariant of Omicron, and I was wondering, you did state that it was more infectious than Omicron itself. Are the symptoms similar, or are there any additional symptoms that we might want to look out for to distinguish the difference?
Right now it seems similar, but we'll wait for the guidance from CDC. They often change.
And then the question for Commissioner Villagomez, you had mentioned that the ventilation system at the Department of Corrections is inadequate, and I was wondering if any measures and actions have been taken to resolve that issue.
I mean, it's working at the moment, but the machine the machine is old already. But at the same time, I am working on it right now, or working at it this time to try and fix the problem.
So I guess I was just trying to understand, because the reason why some of the prisoners were transferred to a different facility because the ventilation system was inadequate. And so if that issue hasn't been resolved, are those prisoners still at the quarantine facility?
Well, the reason why we did that, the transfer, is that we don't want it to even spread more inside the facility. But as we speak right now, we're down to only 3 inmates.
Got it. So has your department taken any actions to resolve the issue moving forward?
We're working at this time.
Thank you. Go ahead.
Hi, I'd like to add to that, just because I think it'll help your inquiry. Previously, we had, even before the DOC got any cases, they had asked my office to assess their HVAC system, and myself and Chairman too, we looked at it. We took their plans and we looked at it. So I think by inadequate too is probably what it's saying is inadequate for a setting when there's an infectious disease, meaning everyone's sharing the same air supply, intake and outtake. It's not isolated like a hotel quarantine site would be, where every single room is you could contain per room. But in a prison or in a correction setting, I think it's inadequate to deal with an infectious disease.
Thank you for the clarification. And when you say an assessment has been done, do we have an amount in mind that corresponds to that assessment?
Well, the assessment was just done to determine if it was safe to treat. I mean, to deal with an infectious disease. Obviously, the answer was no. So it will require a design and study to see what kind of system then could be installed there to address that, to address any future concerns. But for the meantime, we did bring in a lot of UV and HEPA filters to help with air quality. But like many other places, that's going to have to adapt to this new health environment. I think even in here, we can assess and say, how do we make this safer for future events? Everyone's going to have to do that work on their own to retrofit their facilities. I mean, even in the hospital alone, where they only had 4 isolation rooms, meaning they can only treat 4 COVID patients at the time. But now, since then, have sort of retrofitted to accommodate at least 12 for now. But I mean, if we were going to build a new hospital today, probably heavy to consider infectious disease and how to design a new hospital to meet that. So,
thank you for the clarification. Would you know if ARPA funds have been identified to assist with the?
We're not at that stage yet, but we should be talking about it, not just for the corrections facility, but for others. So that would be a good topic or something to address everywhere. Yeah, I agree.
No, thank you.
Thank you, Mr. Guerrero, and thank you, Representative Magofnia. I recognize now Representative Stafford.
Thank you, Chairwoman, and thank you everyone that is here on the floor to help us clarify a lot of these different questions that have been coming to us from our constituents. I want to kind of start with the general big picture, so maybe it would be you, Mr. Guerrero. First question, are ARPA reimbursements dependent on COVID positive numbers?
I am not 100% familiar with ARPA, as I am not the expenditure authority, but in what I've read, it's not related necessarily to cases, or there's a lot of there's a criteria to be met in certain parts of the ARPA funding. The ones that do relate to COVID has its own criteria, but to my knowledge, it's not based on cases.
Thank you. CEO Muñoz, did you have anything to add to that?
Not really. Well, ARPA funds are given to the grants, and it doesn't really apply to the cases. It's just basically distributed based on population.
Thank you. With respect to, you were mentioning, CEO Muñoz, about you guys are revamping the contact tracing. So my question is, just because I'm aware that the testing group is quite a small group, maybe 21 employees or more. Do we know? Testing.
Oh, the data.
Like how many people work in the testing alone?
Wow, that's our nurses and lab and.
Yeah, it's a combination of data team, lab, and nursing. So you can have close to 40.
40. Okay. I guess I ask because right now, especially with the increase in people wanting to get tested and having a lot of confusion and maybe miscommunication about where to go test, what time to go test,
why to test.
Yeah. So and now looking at the contact tracing, I'm not sure how many people work in your contact tracing department.
About 19. 29.
Okay. Is it something that is being considered to maybe increase the number of people who are in the testing groups to allow for more access? Has that been considered?
Well, in regards to access to testing, there is a lot of factors involved. The reason why it's been slowed down, if you want to call it. Do you want me to go ahead? Okay, so we've had some issues with the Sojan test kits, and maybe I could ask Jesse, if you can I ask him to come?
Sure, come on up, Dr. Tudela. Okay, Mr. Tudela, it's been a while. I haven't seen you. Nice to see you. Welcome.
Mr. Tudela, if you could just introduce yourself and state your position. Thank you.
Good afternoon. My name is Jesse M. Tudela. I'm the Chief of Ancillary Services for CHCC.
and also the chief for testing operations for this COVID pandemic.
Thank you. So go ahead.
All right. So the reason why there's a slowdown, about a week ago, we identified some issues with the Sogen test kits. And at that point, we were thinking it was the test kits itself. So we did have to wait for a shipment from Korea, another lot that will we will be able to distinguish if it is really the test kits. That did arrive, and experiments were done, but we were still using the same issues. So, in other words, the tests were coming back with erroneous results, same values dictating being a positive, and also probably an error in dictating a negative. So that's why many of the folks receive presumptive positive, needing to be retested. Because of that, it led to chaos, I guess. People wanting to get tested, which we only inform those who are presumed positive. But also, Omicron news was released that Friday. So, with all those three factors, it led to what you saw, mayhem, that experienced at one location. And that is also another issue. That test site was strictly for antigen testing. It wasn't for PCR testing. But because we have issues with the Sogen and needing to, I guess, combine all the resources available, it was at Coblerville Youth Center. And not knowing potential, I guess, community concern with the Omicron led again to that mayhem. So the short answer is we are trying to identify the Sogen test kits to bring it back up on board to quality control. And we are at the state, I believe, on the last check. And hopefully by tomorrow, we get an answer if it's good to go. So we are resorting to slower PCR testing due to the number of instruments we have. So that is also why there is restricted number of slots. So just to answer everyone's concern, really, testing is for those who are experiencing symptoms. But unfortunately, testing is being used for all sorts of reasons. Work related, USCIS related, you name it. So as the lead person in the testing group or testing operations, it's not really that we don't have the capability or the capacity. I believe it's our community needing to know why the testing versus go get testing. You need to get tested. No, it's more of they need to understand why. Because if close contacts definitions have changed, CDC is changing. So we need to keep abreast with that. And it's not that we're restricting individuals, it's just the time limit. Because we don't want to run specimens. There is a, what do you call this? A lifespan. Yes, especially with the current platform. It can only be done within the next 24 hours. The Sogen can be done in the next 72 hours. So we can freeze those specimens, but not the Abbott platform that we have right now. So those are the factors that not everybody knows, and it's a need to know basis. But again, we need to educate the community. That's why the messaging has been going out, and we are having community-based testing, limited slots, and I'll be frank and honest, those who are registering are actually positive cases. So they're doing the right thing. But then those who are negative, it's for other reasons. And can I share one reason to that? Communities, businesses, if they're not vaccinated, they're requiring them to get tested weekly. For some, I think it's monthly. So there again lies an issue because that test is only good for that day. If you really want your individual worker to be always negative, you got to test them every day. So I don't understand that logic on the business side. Mandate vaccine if you're a business, and if they cannot, then fire them. I'm being candid here. I'm being honest. This is just me. No CHCC involvement, and my opinion. And last but not least, for PSS, they should try and mandate vaccine for all their staff if they are also requiring them to get tested monthly, daily, or not daily, weekly, monthly. So that's just my opinion. Thank you.
Thank you, Mr. Tudela, for sharing all of those big concerns and thoughts about the process. I think it's definitely, I saw the new guidance communications. I think more communications would be helpful for the community to know what to do, because the fear out there is what's kind of driving people to continually get tested, and that does overwhelm your system. I wanted to kind of, oh, go ahead.
Can I add? I think there's also this, there seems to be some doubt on the results, that they get tested 4 times just to try to make sure that they get the right result that they want. So people do get tested a lot of times because they're saying they're negative, they're positive, but they're saying no, they're negative. So they keep trying to get the test that comes out with the right result. Anyway, just a thought.
Yeah.
I received another notice too that the MCAP site at CHC is now charging $57 for antigen tests.
That's always
for
been there.
travel.
It's always been there.
Yeah.
That's only for travel.
Correct.
Okay, so it would be only with respect to travel.
Correct.
Thank you.
But can I add to that notion? And that's why there's a lot of stories that I like to share, but along that same line with CEO, they're doubting the test, but at the same time, they're wanting to get that negative test. Because if they're a positive case, they are prior, you're shedding the virus for the next 90 days. So either it's work, school, or whatnot, they're trying to get that negative test, which might be impossible because you're still shedding. And I'll be honest, yes, we see the same names over and over in the CBT list. And sometimes in contact tracer, CDI, Dwayne's here, there are repeaters. There are prior positives. So we need to educate them. Do not get tested the next 90 days unless you're symptomatic again or it's after 90 days. Then you can get tested. You shouldn't be getting tested in the next 90 days. So I found out from one friend, it's because I need that negative test to go back to work, or I need that negative test to go back home. Period.
Thank you for sharing. I guess more communication is needed, I think, for public education, for the businesses and the community. Kind of going to PSS, has communication improved between, I don't even know which the task force as far as the numbers and stuff, so that PSS can respond accordingly to the data? Is that something has improved?
Yes, tremendously. I think we have a more aligned communication and protocols, and a more understanding of how to support our families. So
Excellent. So one question: if a child is asymptomatic, should they stay home or can they go to school?
we are following the same guidelines, which is if you're symptomatic, the policies for PSS are to keep your children home. If you test negative, of course, and asymptomatic, they're welcome to be in the classroom.
So if they're positive and asymptomatic,
Stay home.
so stay home if they're asymptomatic positive. Yes, that's even for
That's
workers.
the general population guidance, yes.
Okay.
And our, if I may add, our latest memorandum to our staff and our school really is in accordance with the CHCC, which is if you test positive, whether PCR or antigen, stay home and isolate.
Okay, thank you. And my final question is, with respect to testing, to help alleviate some of the congestion, I know that people can order tests. However, we live in a community where we often share post office boxes, families. Is there a way that the government can, or the task force can allow for people to get tests for themselves to help alleviate the congestion and also be able to get access? Because at this point, there are some people who don't. Go ahead, Mr. Villagomez.
Thank you,
Chairman.
Vice Chair. Good question. And we are actually initiated the fire station test, but we are also procuring more test kits and break them into maybe 10 bags and work with our community outreach program and get it out to the community. But again, going back to Chief Jesse, it's really education and paying attention to details, because even if you have access to testing, if you don't understand what your adequate testing, then you're just going to repeat the same problem over and over. Thank you.
You asked about the post office box. We did discuss this with the FEMA and HHS in regards to how, because of the post office box sharing families and even businesses, I think they're even using businesses. So they're looking into it. I know that there's what we call the ticket. We made that ticket request and we're just waiting for them to decide what to do with it. Whether they probably are going to give it to the task force and distribute it. But I do know that people are having challenges with ordering.
Thank you, Ayud.
Thank you, Vice Chair. And I'd like to recognize the presence of Representative Ed Probst. Welcome. Any other members who have questions? Maybe for the second round? Okay. That's okay. Colleagues, Probst, Representative Abata.
Thank you, Chairwoman, and thank you for being here. So we have right now our community of 100.1% vaccination rate. That was reported in the paper. An average of 210 cases per day. We have community centers opening. We have events going on. We have people, dining in the restaurants. We have gatherings happening in the community at beaches. We have weddings going on, as if there were no COVID. We have organizations, businesses, schools impacted because their employees were contact traced. So like last week, I think we only had 8 members of the Bureau able to report to work. Impacting services, right, to our community, impacting businesses, our economy. We have students whose education is impacted, going from virtual to in-person, virtual. We have parents unable to go to work because students, although asymptomatic, must stay home. So my question is for the task force, what is our plan? What does the task force talk about? What's our next goal? We've already reached the vaccination rate. Are we moving in that direction toward planning for what's next? A lot of our community members are just tired of COVID, right? So we have seen a drop in washing your hands and sterilizing and sanitizing, wearing masks. And at this point, it sounds like, the repeat testers, there's definitely anxiety and mental health issues, of course, from COVID. But as a task force, have you discussed our plans for the future of the CNMI and how we can utilize the current funding, the federal funding, to really move us in that direction, whether that be a state-of-the-art hospital or, systems in place to respond to major pandemics like this. What are we doing about it?
Can
Thank
I
you,
start?
Jerome.
So we want to have control, right? We want to acknowledge that that control could also get us back to crisis again, right? So we need to acknowledge uncertainty about the future, right? We know that we can't predict it. I mean, like you mentioned about the new Omicron variant. What we're trying to do here is empowering our people, empowering them to take appropriate actions, right? So let them know that if you're positive, if you're a close contact of someone, test on day 5. That's basically when you would know. Some people test too early. That's the one thing that we notice individuals do also. So test on day 5 if you're a close contact. If you're symptomatic, you can get tests, and you have to be it has to be the right test, and that will be the antigen test, because you would find that current infection. There's So we want to again empower people. That's one thing. We've been putting out the messaging about living COVID safe. You know, we talked about mitigation, about making sure that our hospital. I like that you brought that up, because I did have a conversation with HHS a couple of weeks ago, and when are we going to start thinking about building another hospital? Because like I mentioned earlier about our resources, how can this be okay to have to separate our resources, putting in one area far away, by the way, it's not even close, and so have it also at the hospital. If it's the same people doing the services, from monoclonal antibodies, nursing, treatment, and even to the public health education, we need to be in one centralized place to be able to be more efficient, I guess, if you want to say that, but also to be able to reduce some of the stress that the staff are experiencing. And it's one of the things that I discuss with my staff about, how can I retain them, right? I mean, they're obviously tired, and how do I make sure that we provide them the time to stress out? I mean, to get the stress out of their system. It's been difficult, I'll tell you. So we know that we need to build. Yes, definitely, we need to build another hospital. So I was so happy when the Region 9 administrator contacted me and said, hey, we're going to be there, we're going to do an assessment. And my answer to him was, it's about time, because we did discuss this early in the stage, right? When FEMA, back in 2020, about, we're always going to be the only players in town. We're always going to be the people that are probably going to be addressing and treating people. And yet, as much as I appreciate the fact that we have a different location, I really wish it would be in just one location. But it worked. It worked with what we could do now, because they said they couldn't build, but they can definitely help with renovation of another facility. So we just had to accept that. And so, but moving forward, who's to know what infectious disease comes again? And you're right. We need to start planning. So yes, part of our planning is looking for mitigation measures. We're basically putting all kinds of air cleaners in throughout the hospital facility. We don't want hospital acquired infections, and we also want to be able to make sure that at the end of the day, it's also about the human people that are going to be running that operation, and it has been a challenge.
Right.
Thank you.
Thank you, CEO Munya. I believe that we can be responsive and plan at the same time. And so I guess my next question would be to Mr. Warren, who is on the task force? And is it the same number of people who were there from the beginning?
Yes, it hasn't changed. The task force's formation hasn't changed. As we continue to pivot to new directives, new measures, basically the primary working group is this. This is it. Gerald, Patrick, myself, CEO Munya, um, of course, Defense, CODA, the primary CPA for the borders, Customs, Department of Finance.
And do you have members of the nonprofit community there?
We
and
we
legislators?
have members of organizations such as the UFOs, different big group that are out there, Korean Association, and just like how we formalized the forum last Friday, it was an invitation sent out to for engagement. So I just want to add, Rep. Babalta, in regards to your statement about the exhaustion of our community, and thank you, CEO Munya. It's really deputizing our people, and our main goal on the task force is to reduce the stress of CACC, and all the work from building the MCATs, the alternate care site, the youth center site. It's really getting out to our vulnerable villages and population, and we measure those on a daily basis, and not to forget Rhoda and Tinian. That is another unique population and challenge, transporting them, setting up quarantine sites. The requirements that we have in place at a quarantine site, such as mentioned by correction, ventilation. No one had planned for a big infectious disease outbreak, and ventilation is our biggest problem. Our only post office for the longest time. I don't even like to set foot. Thank God that a company came out with air scrubbers. Now at least there's some safety measures in there. But I mean those are the things, and we're talking about our infrastructure. But at the same time, when we sit down, we need to be also mindful of federal sites that are in place, such as the post office. Thank you.
Thank you, Rep. Babata. I recognize Representative Probst.
Thank you, Madam Chair, and thank you all for coming in today and answering our questions. I do apologize for my lateness. I have a few questions, and perhaps I'll start with the CEO, if that's okay. We've heard about, as Chairman Villagomez has just mentioned, about this pivot, new directives, new measures in place. Things are, I guess, it could be. It's hard to predict what's going to happen. I think we can all agree with that, with these variants that are coming out and all kinds of things happening. But with this, with new directives in place and new measures, one of the things I've noticed is going into like smaller businesses and everything. No one is, thank you. No one is like asking us to sign in anymore or anything. Is that one of the new directives, that when we go into private, small businesses, we don't have to sign in and check our temperature? Could you elaborate on that? Yeah.
So we that was very helpful in the beginning when we did not, we were doing contact tracing. But as contact tracing stops, or shift, our strategy shifted because the the pandemic has shifted. We want to make sure that, we can't look at that book. We can't look at those information. We haven't been looking into it, if you want to.
Thank you. And I would say that I understand why, because it would be the way that COVID is prevalent in our community. I think per capita, right? We're at the highest in the United States. Is that correct? In terms of the COVID number of cases, we're
Yes.
at the yeah.
Yes.
So it's at a peak, right?
Yeah. So as Dr. Mojun explained at the forum, is that every state in the nation, and then of course Guam, there is that peak.
Sure.
We are basically on the late stage of that peak. So
Right,
we just
right.
started slower.
Yes,
But,
and we're grateful for that. We had a head start with all the vaccines and everything. The reason why I asked is that, so like to do a logbook, it just doesn't make sense right now. I mean, if somebody were to go to establishments, like 5 different establishments in one night, and then you'd have to go back. So basically, it's not being done. And the reason why I asked this is I do believe there's a company now doing like a digital logbook. I see that there's an application, an app that you download, you put in your phone number and personal information and stuff. So whose idea was that for the digital logbook?
Not really sure, but it all encompassed and started out with the health declaration, paper health declaration, early December, and then it got transformed to the digitization of a health declaration form under the turnkey working group company. Um, and then as COVID evolves to its highest level, the travel bubble came into play, Korean tourists, you know, adaptation towards modernization and real time information kind of derived. It started out with MVA on how are we going to continue on tracking, as well as working hand in hand with CACC and the task force in regards to the impact of tourism. And correct me if I'm wrong, Congressman Probes, if that's if I'm driving into that same question that you asked, that's where it originated. And you know, as we also pivot again towards, you know, subsiding the infection, you know, taking away contact tracing and so forth. Maybe I'm not sure at what level do we still need that particular program.
Thank you. And the reason why I ask this is I do question the need for it, and here's why. I've done, you know, my fair share of research and have talked to people, but this application that you download and you put in personal information and be tracked or whatever, it failed in different places. It wasn't practical, but here we are doing it here. So I'm just curious because I've asked members, my colleagues, I've asked other people, would you download this app and put in your personal information? And everybody said no. So the buy-in in order for this to be successful would mean that everybody who has a phone, presuming everybody has a phone, would have to download the app and essentially be tracked. Is that how this software works?
Is that the one in the front? You guys have it too, right? Is that the one in the front? No, that was different.
No. No, I was told that there's an app that you download.
Oh, okay.
So you guys aren't aware of that?
No, we're not aware of that.
Okay, so no one's aware of that.
No one. And then I just recently came from a DC trip. Every establishment, it's not requiring write-in of information. It's, are you vaccinated? Can you show a vax card? Because that's my point here is, I think that's where we should be at, requiring establishment to ask for the vax card.
Thank you. I'm just trying to get information on this app that I was told about and that you're supposed to download it. I even saw it to download this app, and that's why I'm surprised no one's heard of it. But, okay, well, we'll get back to that. Okay.
I mean, just real quick, is there a contract with the government for this digital logbook app?
I've heard of this app, and I tried to utilize it too at one establishment, but it's not a contract under Homeland Security, not to my knowledge.
Okay.
I know in the beginning of the tourism with MBA was to track tourists' movement and activity, but I know they made it available, I guess, because as I saw too in the restaurant, I think I used it twice. That's about it. But it's not something that we engaged in.
Thank you.
So if there is a contract, it would be with MVA, but it wouldn't go through any of you on this panel.
I know MVA made the request for tourist tracking. For sure, on my end, a lot of eligibility questions come up if it's towards non-residents or people not residing or citizens of the Commonwealth, so it wouldn't go through our office. No.
Thank you. Proceed, Representative.
Thank you. Thank you, Chair. I'm almost done, but I just was curious about this because I've heard so much about it. I heard there was a big contract for it, and I would think that before anyone even proceeded to hire this company to do this app or whatever it is, that they would certainly go through you. And you guys are the experts. You're the leaders that have kept us safe. I would I would just think that they would have gone through you and said, is this a good idea? Is this a good app? Do you guys support it? And get your honest feedback. So I'm a little disappointed if that step was missed, and we hope to find out more about it. And just one more, if I may. Um, uh, Chairman Warren Villagomez had mentioned ventilation is our biggest problem. I think is that correct? Inadequate ventilation, right? Especially you mentioned the post office and the problems that we're going through at the Department of Corrections, right? So I'm just always concerned about what is being spent on treating certain things, and especially when we see exorbitant pricing for things. Case in point, of course, and I'm sorry to bring this up, Commissioner, but the Department of Corrections had spent $257,000 in 17 days for sanitizing, and I'm just wondering, like, how is this sustainable, and how could it be for Madam CEO? What does CHC spend on sanitizing CHC per month?
I believe it's 30,000 a month.
For the whole CHC, 30,000 a month.
Approximately. I don't. There may be add-ons.
Thank you. And I want you to see why a lot of us are concerned when we see the amounts that are given to a particular company. My next question is this particular company still being hired at Department of Corrections? And are they also continuing to sanitize the multipurpose building?
I think that's a question for Homeland as they see all the contracts. But if we can, a lot of times the two words that are often interchanged. I don't know. I've never looked it up in a dictionary if they actually mean the same thing. But sanitizing, or sanitation services or disinfection services. Those are all. I mean, they vary in what type of service. I guess the hospital, they probably have a contract that with a company that mops and cleans the floors every day. Maybe that's what costs 30,000. We have contracts at hotels for positive cases and or even non-positive. As in the very beginning, we had to make sure we're sanitizing, disinfecting, using UV lights and all that. All different types of services under that kind of umbrella. So it's I think to be more specific, we should be asking what exactly was done and where, because we have been since the very beginning. We've spent close to $18 million in total in disinfections for this entire COVID operations of quarantine sites, airports, and everywhere else.
Thank you.
And it's an eligible expense under the public assistance program as an emergency protective measure.
And I appreciate that. And I want to give you a comparison, just so that we can put things. We do know, at least I know, the difference between your basic sanitation services or sanitizing. A lot of times when you're talking about sanitizing, it's, a lot of times spraying or whatever. But our director of the Legislative Bureau, Perry Tenorio, he went out and got quotes for sanitizing, not just, we have custodian services that clean our surfaces and everything. That's different. But this was to actually sanitize and spray this entire legislature. Do you know how big this building is? It's over 30. I have it right here. All right. It's 33,127 square feet. So over 33,000 square feet, and it's complex. It has different rooms, different chambers, all kinds of stuff. A company was hired. He went and got different quotes. A company came, same thing, they're spraying and everything, and they did everything from top to bottom, every room, bathrooms, everything. $1,600 for one day. $1,600. A legitimate company that does this, that has a lot of experience, and that was the lowest quote. The next one was like I think it was like 2,000 plus or 3,000, about 3,000. Still far less than what we've seen charged. So again, our concern is like as leaders is that of course we understand the importance of sanitizing, but we have learned enough about this, and we've learned this from doctors, from experts, that you could actually sanitize your own office. And if you wanted to sanitize and do something, you could go on Amazon, get the same product ordered and the wand for about $300, and you could sanitize this entire building. So again, I just moving forward, I am concerned about these runaway costs, and I hope to God that you guys level the playing field by allowing every sanitizing, not sanitation, every sanitizing company available, allow them to bid on these so that we can be fair. Thank you.
Thank you, Representative Probst. And if I may just ask Commissioner Villagomez if you could answer his earlier question. Is this company, I believe it's called Jogo, are they still providing sanitizing services to this day for corrections?
No,
No. As of when was the last date of service?
I'm not sure on the date.
Do you have another company providing sanitizing services now for DOC?
It was through Homeland Security. They're the ones who designate who to go down to sanitize or disinfect DOC.
Okay, so SA Delian Guerrero, who is providing these services, and could you also answer the question, will there be a bidding process for sanitizing services for the government?
Of course, Chair, we are in a draft. We have a draft RFQ that we're going through right now. But back to the question on was there any other disinfection company that had worked on at DOC? Yes.
So there is another one presently providing services.
On-call basis, as needed.
Okay.
Basis, sorry.
And what was the last date of Jogo's service?
I have no the date. I'm not sure, but the last request from DOC for disinfection services was about a couple weeks ago.
Okay, thank you. We'll take a few more questions. I think Rep. Bassel, did you have a question for the first round? Sure, Rep. Bassel.
Thank you, Madam Chair, and good afternoon. Thank you for joining us again this afternoon. Mr. Warren Villagomez, I know you're a member of the board, MVA board, right? How much have we spent on the travel bubble itself?
Congressman, Vice Speaker, I'm not sure on the amount, but I can ask Priscilla to provide you those details. We did designate Ivan Kichicho as the trip chairman, and yeah, so I don't have that.
Okay, so can we get that information maybe
Sure.
on a later date? And in the same line, how much did the that app that was used to trace these tourists that came in, actually, how much did it actually cost MVA?
I'm not sure if there's even a contract, but I know the discussion what got carried on early. Yeah, yeah, it was.
It was a I believe when they started having flights
Mhm.
coming back. We talked about it, but we were thinking about the manual. I kind of suggested that we could, make it into a card, and tourists would look at it as a souvenir, and get stamped wherever, which restaurant they go to,
Mhm.
and then if they test positive, because we do test them
Mhm.
on arrival, plus they also test out on day 3 or 5, and that's something that they could be able to take home with them if they're negative. But if they're positive, then we could definitely take a look at it, but then also they could also use it, still take it back eventually. But it was more like a souvenir item, versus making it digital. So
Okay.
that was our discussion.
Yeah,
right?
no, because I remember that the discussion back then before the travel bubble was to do like a passport.
Yeah, like
It
a
was
passport,
it's a
exactly.
tourist passport for every destination. But
Yeah.
but I know that they were also talking about an app, and obviously Mr. Guerrero had mentioned that the app was actually done. I think we need to understand how much it actually cost us to get that app. And who was the one running the app?
Yeah, I don't know the details of the contract, but like CEO in the beginning, where they presented, or we were talking with MVA about passports
Mm-hmm.
and contact tracing among the tourists. Then it would have been nice, yes, to have a digital one in this day and age. We found it very useful for our operations to have things digitized. But all the way through completion or use of that, not privy to a contract or anything on our end.
Is it possible maybe to get those information through MBA? I guess.
Yeah.
Years ahead of
Yeah,
the
and I
travel.
can look to on my end.
Sure,
Yeah.
I would appreciate that. And then just Mr. Guerrero, I know that they've asked questions in regards to, obviously, a lot of these costs is coming through Homeland's expense, correct?
Well, it's through the general fund, and then we'll turn around and submit this expense to GAR's office for consideration for reimbursement.
All right, thank you for that. If it's possible, can we go all the way back to March of 2020? And we would like to have all that information from you, all contractual agreements and expenditures starting March of 2020. Is that possible to provide this committee through Homeland?
The same.
Would that be something similar that we provided to Representative Magofnia? Just to, but we can provide you, but it's going to take a while. But if we have a spreadsheet that we provided, Congresswoman Magofnia.
I do. So I'm sure.
Okay, so the broken down details all the way back to 2020, all contractual agreements and companies and
Yes.
all the associates. All right, so if maybe we can get it from her, and if we have any other further questions, we can.
Of course.
Thank you. Are you for now, Madam
Thank you, Rep. I'll recognize Representative Manglonia.
Thank you, Chair. Thank you, Task Force, for coming in. The question that I have is basically on the quarantining. Is there any future? When do you anticipate phasing out the whole hotel quarantining procedure for people who test positive? Our borders are basically open. People coming in, not having to get tested. We don't know who's bringing in what, and just looking at our numbers from October 28, it doesn't seem to, decline. These numbers coming in on a daily basis are pretty alarming. And so, is that working? And if not, what are other steps that we can take to reduce it if the quarantine is not working?
Yeah, I forgot. I didn't mention it earlier about the testing, but really, when we're saying that empowering the people, we're asking people to that when you are a close contact, you do need to, at least get tested on day 5, but in the meantime, continue to practice your 3 Ws. And then if you do test positive, or if you go and get tested, waiting for your result, you really should isolate, from others. And that's the empowerment that we're asking people to take on their own. However, as we had seen, we have individuals, for example, parents who are saying, I can't quarantine, I can't isolate myself from, in the household. So that's when the government comes in and says, okay, we can provide a room for you. So yeah, just wanted to make sure that if you're positive, yes, you do isolate. So I'll turn it over to Gar to explain about the quarantine.
Yeah, to add to that, and also because of the changes we've made to our protocol, we don't we don't have a requirement to quarantine any travelers no longer, vaccinated or not vaccinated. So we haven't been doing that. And with more people qualifying for home quarantine, most people these days positives are quarantining at home. Who we're quarantining these days, and we actually closing down one site again. We're not checking in anyone to the PIC. So as those guys check out in the next few days, finish their 5-day quarantine, or some of them take 7-8 days to be released based on the medical assessment, then we probably will end up with just Kanoa at the end, since our alternate care site is there. And who qualifies for quarantine, we're actually trying to make it harder for them to quarantine for to qualify by saying, do you really need to quarantine in a hotel? Can you self-isolate at home? Unless they say, I have a sick grandmother, I really don't want to pass it on to her. Can I utilize? And while the program is still available through FEMA, then we will allow it. Um, in Tinian, we did quarantine in the very beginning there, some of the first positives. And then after, and even on a smaller second wave they had of a few cases, but now they seem to have adopted to the I can just quarantine at home. It's safe to do so. I'm not going to pass it on to my other family members. Rhoda is their first cases too just recently. We understand the anxiety in the community, and they actually wanted to see their neighbor being picked up and not isolating right next door to them. But we see them changing too, and starting to accept that they could self quarantine at home. And I think they're seeing it because sometimes a family member and a positive family member and who's a child and then a father end up going to the quarantine. At the end of 5 days, the father doesn't even get sick, and they end up going home, and only the person that originally tested is positive. So they're starting to feel like they can also self quarantine at home. I, as much as you would like to see the end of quarantine facilities, so we're moving towards that. Thank you.
Thanks for clarifying.
Thank you. And I recognize Rep. McGoffney now.
Thank you, Chairwoman. I have a couple of clarifying questions. The first one is for CEO Munya. So first, is the 5-day testing still optional? Yes, it is. Okay, so with that being optional, what kind of impact do you foresee or anticipate happening in our CNMI, especially since the subvariant is so close by, just hundreds of miles away from us? What do you anticipate?
Well, first of all, I think based on our resources, we want to be able to, again, make sure that at least the community is our focus, right? To be able to make sure that they have the treatment. We have vaccinations already, boosters are out there. So we do know, and again, we're seeing positive cases from arrival right before we made this decision. We are seeing prior positives, a lot of prior positives. So there's not like they're really a threat to the community, but more the community is more threat. So we also see cases where there's probably even one in a flight, right? So we felt that especially during the time when we had our issue with the testing, we were at a situation where it's like, do we really need to test these individuals coming in when our community is longing and yearning for tests? So we wanted to make sure that our resources are really there for the community, and of course the individuals that are coming in have again, empowering the people. Like if I have someone coming in, a family coming in, just arrived, I probably say, hey, you stay away from us for a while, and until you test, and then I'll visit you. So things like that is know what to expect, and we're hoping that the community understands that, and hopefully we can get the testing back to par where we're processing 600 tests. He's already frowning. 600 tests per day. That would be something that we can support and help out the people. Thank you.
Thank you for your response. My next question is for PSS. So as Mr. Tadella stated earlier, when a person tests positive, right, it stays in their system for at least 90 days. And so how would PSS handle the kids who have tested positive and then were able to quarantine and all that, and then when they're better and takes another test, and is it still going to show that they're positive, right? So do we keep them at home for 90 days?
No, they can return to class because I believe they're not at a contagious state anymore.
Okay, so the school would know based on the test results that this kid may have tested positive prior, and it's just in their system for 90 days.
Correct.
Okay, thank you. Sorry, I have one more question. So this is in regards to the JOGO. Mr. Gerald. And I know that we had met sometime in December, I believe, right? And at that point, we were trying to get some information about the contracts. You did share with us that at that time that there were no contracts in place and that basically uh, Chair Warren Villagomez would just make the recommendation and then you guys would be the one to do the contract. So since our conversation in December, has a contract been issued to Jogo?
Apparently not. The reason why is during our conversation, I brought up the idea of having an RFP to see out in the community, hoping for other vendors to submit proposal. But we are, this is along with the guard's office, drafting up a RFQ for these services. But from the time we met, we haven't had a contract with Jogo.
And then going back to Commissioner Villagomez, so you had mentioned earlier that it was Homeland Security who hired Jogo, and so how did you come about with hiring Jogo and not soliciting any other companies that provide a similar service?
The second request, or the first request that came up to the EOC, was for the second disinfection services for the EOC. The first one was I guess, it was a call that was made because the other services or vendors could not provide the service. At the time, DOC was needed of disinfection service. The second disinfection services that was done at DOC went through the EOC.
So are you saying that DOC made the recommendation for Jogo to come in?
It wasn't Jogo. The second disinfection service that was done, it was not Jogo.
And so the first one.
It was Jogo.
Right, it was Jogo, but they made the recommendation?
It was through the task force.
Through the task.
And that was after conversing with the chairman. It was the.
Are you referring to Chairman Villagomez?
Correct.
Okay.
So after a conversation we had was they reached out to two companies, and at the time they weren't available.
So it's been quite some time since our meeting. That was back in December. And is there a reason why the contract is still not in place for, at least for the services that they've already provided?
What I understand and remember too was I've met with Commissioner Wally, and he would go back to Jogo and try to get down to the numbers before submitting the invoices to us.
So are you saying that the services was provided before the terms and conditions were determined?
That's correct, ma'am. It was an emergency services.
So if the cost was so outrageously high, it would have still been justified enough to obtain their services because then it's an emergency.
At the time the request was made, there was no other vendors that could do the services.
And what steps were taken to determine that there were no other vendors available to provide the service?
Okay. So at the time when DOC was on fire, my director came to my office and said, we need to disinfect DOC. And then apparently she um, notified Captain Manny Kitanu to reach out to uh, SMS.
Sorry, who's your director?
Director Georgia Cabrera. She told Captain Manny Kitanu to reach out to safety management. Apparently, at that time, that moment, safety management was busy disinfecting other locations. And then from there, one of the staff told Director Cabrera that Jogo is at the multi-purpose. Why don't we call them in right now before it even spreads inside DOC? Because, you know, at that moment, all we're thinking of is the life and the safety of my officers and the inmates. That's why we brought in Jogo to disinfect the area at that moment.
Were there any other vendors that were solicited? You mentioned safety management. Were there any other vendors? Because according to Gerald, um, you guys you guys looked everywhere and everybody else was busy. So Jogo was the only one that was available. So who were the other vendors that you guys checked?
Well, according from them, they only check safety management. And the reason why they called Jogo because it was close by and we needed them to come in and disinfect the area.
Okay, so I was just clarifying what he says because he did say that you guys did solicit other vendors. That's it. Thank you.
Thank you, Rep. Makofia. And Vice Chair Staffler.
Thank you, Chairwoman. I wanted to go a little deeper into vendors. Are there vendors who have not yet been paid for services rendered regarding the COVID response so far? Technical difficulties, thank you. That's the delicate one.
Vice Chair, there
are vendors who have not yet been paid. Why have they not been paid?
a lot of this is the I guess the transition from the old financial system to the new financial system. So we're working with the vendors. One example is like a vendor would need to register with the new Munis system. But yes, there are vendors that we still owe.
Are there a lot of vendors, like small businesses, that have yet to be paid?
There is some small business, including large business.
Okay. I've been hearing lots of different vendors who have been sharing this, that they haven't been paid since when, Representative Makofnia?
I believe since last September and even prior to that, but the latest ones that I got was the small vendors that provided services back in September, and they have yet to be paid to date.
So just knowing that it's really hard for small businesses to stay afloat, especially in this pandemic, and it would really behoove the task force and Homeland Security or whoever is doing these programs to try to help these vendors get paid, because it is really hurting them, all of them, from the small to the large.
But we're working closely with the Department of Finance. There's some delays where it's just a matter of an invoice that was not stamped. So, we encounter errors too. So we have to go back and forth and make sure that whatever documents that's missing from what we submitted is provided to them, or vice versa.
Thank you. We'll get an update at the next meeting.
Sure.
Thank you.
Thank you so much. I want to be respectful of our panelists' time. I know we are over your 2:30 mark. Thank you so much for your presence today. Ms. Yumel, if you could stick around just for one last question for PSS to touch base since our last meeting, I would appreciate that. I think they have to leave now. Yeah, but you're welcome to make your statement. Yeah. Yes.
Sorry, I just want to make the statement. I know you guys have to leave, but what was mentioned earlier, here it is right here on the governor's page about Safe Travel Marianas. Just to read it to you, Safe Travels Marianas STM is a web and mobile application that enables contact tracing by alerting its users if they have come into close contact with COVID-19 cases declared by the governor's COVID-19 task force under suspected, probable, and confirmed statuses. So that was what I was mentioning earlier about this app that you download, and I just Googled it, so it is there. Thank you.
Thank you, Representative Probst. And thank you to our panelists who have to leave now. You are excused. And I really appreciate the updates you provided today. And we'll keep in touch and schedule another meeting for another update in the future. Thank you.
Thank you.
Ms. Umel, so just to touch base, since our last meeting, I think in December, there were issues that were raised by PSS. You mentioned that information sharing protocols with CHC and the task force have improved, and I was wondering if you could speak to the specific types of information that PSS at the time mentioned needing. So, like to be able to identify the numbers of students and staff at each school who test positive, and where these schools are. Are you able to access information like that, similar to how information is shared about dental and immunization records?
Yes, there's been great improvement. Prior to the next quarter screening that we're actually doing along with vaccination, data is actually given to us far more in advance than in the past. And I think it was due to more communication on what were the improvements that needed to happen from our last experience.
That's great to hear. And then also at the last meeting, PSS was just beginning to roll out vaccination at the schools, and there were concerns at the time about student absenteeism, with I think one school reporting 80% absentee students. Could you give us an update on the vaccination program, and where are we at with respect to student attendance?
So I do, if you don't mind me grabbing the data. Our vaccination rates actually in the schools, we are currently doing our second dose and boosters at the school level, school-based vaccinations, and that's for all schools. And we are currently, for our middle and high schools, we have an 85% vaccination rate for all schools for PSS as a district. For our elementary level, we are at a 65% for all elementary. And again, we are just going through the second dose and boosters for that, the eligible population for our students. For our staff, of course, we are at a 90% plus vaccination rates for all PSS staff. As for our attendance rate, the biggest issue that we are facing really is the contact tracing that the families are going through. There's a lot of self-reporting. There's a lot of just waiting for test. And so they opt to stay home. There's also fear. We do have data on that. And if you don't mind, I'm going to grab that up. But last week, week 3 of since our return, we've actually had 132 teachers or staff, sorry, let me say staff, who were in quarantine. We had 463 students reported for the entire district as in quarantine. And then we do have certain percentages that are awaiting results. So
that was just last week.
This was by
students?
as of Friday, February 11, I believe.
Okay.
So we do have it's daily that we are tracking at all levels and at each individual schools. And we do have an updated protocol that's been put in place for our elementary and middle schools.
And is testing available at the schools?
We did just complete the third quarter testing. We are in communication and planning mode for the fourth quarter testing, but we are highly encouraging our families to take advantage of the CHCC DFEMS sites, as well as the CBT if they are symptomatic.
Okay, thank you. Do any of the other members have questions for Ms. Umel? Representative Stepler.
Thank you, Chairwoman. I just wanted to share, after listening to these things and having my own experience with a positive child, I think it would be really important to communicate it more with the schools, because I'm still being asked to provide a negative test, but I can't. So I just like to ask for that communication. Thank you.
Thank you. If I may add, because of the latest forum that the task force had engaged PSS with last Friday, we have updated as well. So we are following the same protocols for families. I mean, we don't want to add something extra, something different to make it harder for our families. So it is that if you test antigen positive, you can take a test kit and upload your photo and get a clearance from there, isolate. And that's all. We're just trying to be streamlined and aligned with the task force protocols, because families are very, very overwhelmed with stress with this whole COVID.
Thank you, Vice Chair. Any other members have questions for Ms. Umel? Thank you, Ms. Umel, for your time today and for sharing this information. You may be excused now.
Thank you
Have
so
a good
much.
day. Thank you. Welcome, Representative Selena Babauta. We'll catch you up after this. Colleagues, do any members have any comments, any thoughts about steps forward, or any lingering questions that the committee should take up at a future meeting? Representative Atto.
Thank you, Chair. I think Gerald, I spoke to him a little bit after, but there's one thing that I think we need to get about, since Homeland is doing a drawdown. I think there's a big impact to the $40 million deficit that we had for 2021. So I guess the question I was going to ask him, and I'll give him a call, but it's how much it's actually expended, how much they've requested from the PA office, and how much has actually been reimbursed to the PA office to pay back the general fund. I think that might actually have a big impact to the general fund's deficit. Now, is it 40 or $44 million?
It's definitely over 40. I think it's 42 million actually, right? Yeah.
See, so the 18 million that was reimbursed, and that 18 million, that you got to remember that that's also the same period of the U2 reimbursements. So I think the COVID reimbursement is a bigger challenge right now, because of it's kind of clear how they're using local funds to pay for these vendors, and so they're technically not touching federal funds.
Right.
And if they get denied for reimbursements, that's going to be the challenge. But we'll get to that point.
Yeah, I think that's a great point, Rep. Atto, and a huge concern for all of us, because the government is tapping the general fund first, and because all of these COVID-19 procurements are being done on an emergency basis. We have situations like with the sanitizing purchase orders that were made, or requests, or whatever they were called. There was no contract, but apparently these decisions were made at exorbitant cost, right? And that's just one vendor that we know of. And we have a whole long list of vendors that were provided services on this emergency basis. And to what extent we're incurring humongous costs to the government, and it affects the general fund, and to what extent will we actually be reimbursed in the end is a huge question.
Yeah, and we had a Wally here for corrections, but I think the bigger question should be the multi-purpose, because that's right directly under the governor's office, and I don't know who's in charge. Is it the SAA that's actually in charge of that? So obviously there's a contractual agreement between the SAA to JOGO to Homeland Security, and Warren's definitely doing the negotiations somehow, because that's how they're getting the information, right? So I think that's really important. We need to figure out the multi-purpose, also that contractual agreement. At the end of the day, they're going to blame Homeland Security for it, because they're signing off on these payments. But it's who's actually making the contacts and making the contractual agreements between Homeland and the vendor.
Right. I think a follow-up question maybe for Rep. Magofnia, since you're the lead on this, is uh, what is the holdup with the request for quotations? Or, I think Mr. De Leon Guerrero mentioned wanting to do an RFP like more than 2 months ago now since our last meeting. So why are we here now in February? Sanitizing is still happening. Why has there been no request for quotes or proposals?
Yeah, and in addition to that, he's talking about the Munit system. These other companies have been around for so many more months, I guess you can say, right? Not years, but a new company automatically is in the Munit system and getting paid upfront. Matter of fact, $130,000 upfront payment. So that 130,000 upfront payment, what contractual agreements or what services were rendered? Is it just the multi-purpose, or were there other entities that actually got the services?
Thank you, Repeta. Vice, did you want to add to that? No. Oh, Representative Selena Babata. Yes.
Thank you for recognizing me.
Honorary member.
Sorry for being late. I was listening in on Facebook, but I would like to get a listing of contracts that have been executed since the start of COVID from the COVID task force. And even with respect to the questions about this application that's supposed to initially, track tourists and was eventually made available to the general public, nobody seems to know the details of that contract. They don't know if the GAR is responsible for it. They don't know if Homeland Security is responsible for it. I mean, that's the reason why we have these meetings, is to get answers. And today, I don't think we got the answers that, to most of the questions that we've been asking. And I think it's important to get all the contracts, including any change orders, amendments, and so we can find out exactly how much of COVID funds have been used to mitigate COVID, spread here in the islands. It seems, as the vice chair said, companies just pop up overnight, and all of a sudden we have, they're supposed to be, they're getting contracts over other companies who have been established here longer and have more experience in doing some of the things that are happening. So I respectfully ask this committee if they could get a copy of all the contracts thus far that have been executed by the task force, whether it's the guard, the corrections, or Homeland Security, because they seem to be pointing fingers at each other, not wanting to give us the information that we need as policymakers to make sound decisions when it comes to budget season. That is all, Madam Chairwoman.
Thank you, Rep. Babata. And before you enter the chamber, that question came up also, and SA De Leon Guerrero has provided Vice Chair Magofnia with the listing of contracts and purchase orders, right, going all the way back to March 2020. So
Yes, so I just forwarded that particular email to every single one of us in this chamber. And because it's so, like, the file is really huge, like, we would have to identify which particular vendor we would like to see contracts from, because they have binders and binders at their offices. So we wanted to kind of narrow it down as to which specific vendors we would like to see contracts from. And feel free to take a look at the spreadsheet and let us know which contracts you want to review.
Vice Chair Staffler.
Thank you, Chairwoman. And to what our Chairwoman of the JGO did mention, I wanted to include also POs, which I'm glad you mentioned too, because there are more than just contracts. I'm aware of different vendors who did not have a contract, but are provided services and maybe provided an invoice and did not even get a PO yet. And so I don't know how they categorize that, but that is something we should have to also keep in mind.
So great point, Vice Chair. And I think other issues that I thought would be worthwhile to follow up on include this came up to some extent with Rep Probst mentioning just a lot of confusion in the business community and in public facilities about what the COVID-19 protocols are. And there's a lot of inconsistency and just kind of a mishmash of businesses doing different things. And I think for a follow-up, I'd like to ask the task force if they are considering issuing new directives or at least new guidance for businesses about, if the sign-in sheets aren't necessary, then that needs to be communicated. If, taking temperatures and sanitizing everybody that comes in is not necessary, then that should be communicated. And similarly, if businesses are requiring PCR tests for their employees to come back to work, and these employees are part of the reason why the system is overwhelmed, then that also needs to be communicated, and perhaps more explicit guidance could be made available so that we are making sure that the people who really need testing are getting access to these tests. So that would be for follow-up. Any other comments or questions at this point? There being none, may I please ask for a motion to adjourn this meeting?
Second.
The motion has been made and seconded. All in favor of adjourning this meeting, please say aye.
Aye.
All opposed, please say nay. The motion carries. This meeting is now adjourned at 3:01 p.m. Thank you, colleagues.
The Jones Act is a 1920 law justified on national security grounds as a means to bolster the U.S. maritime industry. It restricts domestic shipping to vessels that are U.S. built, U.S. owned, U.S. flagged, and U.S. crewed. However, this law boosts cost by banning foreigners from competing and forcing Americans to purchase ships that are up to 8 times more expensive than those built in other countries. The result is higher transportation costs. Shipping oil from Texas to the Northeast, for example, costs 3 times more than importing oil from Africa. Ultimately, consumers foot the bill. In addition, higher shipping costs push freight from ships onto other sources of transportation, such as trucks, which means more traffic and pollution. Meanwhile, this blatant protectionism has failed to benefit builders of ships in the U.S., whose production is less than 1% of those in China and South Korea. Domestic builders have seen over 300 shipyards close since the early 1980s. Jones Act defenders claim the law ensures adequate U.S. ships during times of war, but during U.S. deployments during Operations Desert Shield and Desert Storm, foreign flagged commercial ships carried twice as much equipment as their U.S. counterparts. In fact, the U.S. was so desperate for shipping that it twice requested the use of a cargo ship from Moscow. Both requests were denied. So the Jones Act has failed to achieve its shipbuilding and national security goals while driving up costs for consumers. It's time for this outdated, costly, and ineffective law to be repealed. It's time to end the Jones Act.
Half a day. This is Governor Lou Leon Guerrero. If you're struggling to pay rent and utilities because of the pandemic, your government can help. Our Emergency Rental Assistance Program provides direct relief to you. To date, over $6.9 million has helped over 1,500 households.
Apply online at eoa.guam.gov or call the Department of Administration's Emergency Rental Assistance Program at 671-638-4518 or 19.
Have you or a loved one been injured through medical negligence or substandard medical care? Are you angry? File complaints through the Guam Board of Medical Examiners to make physicians accountable. It's time that we stand up to protect our families and the people of Guam. The complaint form can be found at GBME's website, www.guammedical.org. Have questions or want the form emailed to you? Contact us at asher@asherdeanlubofsky.com or our Facebook page, www.facebook.com/bunzoasher. We do not provide legal or other professional info or services. We do this to improve medical care on Guam through medical accountability equity. Justice for those injured or killed through medical negligence on Guam.
Hafa Day. I'm the owner of Guam's largest tourist attraction group. The pandemic